Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Low level of compliance with COVID-19 safety protocols in Edo State capital as the state government insists it has intensified enlightenment campaigns. Kano State is also dealing with non-adherence to safety guidelines in one of its local government areas with a high number of COVID-19 cases. And UK Prime Minister Boris Johnson sets out plan for significant normality by Christmas. So we begin with the national figures of coronavirus cases in the country from the Channels Television COVID-19 case monitoring dashboard. You can see the daily updates on the coronavirus disease situation, and in 24 hours, of course, the NCDC reported 595 confirmed cases, and they were reported in 23 states, including making 24, and that is plus the Federal Capital Territory. And that has made the total confirmed cases at 34,854. Now, in terms of the numbers discharged from yesterday's figures, it's increased as well. 293 cases were discharged in 14 states. Abia with the highest, 70 patients discharged, followed by Kaduna 64. Edo also discharged 51, and several other states. And that's why you have the total there, green, those recoveries there, 14,292. But sadly, we recorded 9 deaths in the last 24 hours in 7 states. Ebonyi 2, Edo State 2 as well, Adamawa 1, Anambra 1, Bayelsa, Kano, and Lagos 1 as well. You're seeing that these are cases from all 36 states in Nigeria and the Federal Capital Territory. And indeed, it's a representation essentially of what we're seeing in terms of the confirmed cases. Also, the Center for Disease Control in Nigeria talks about all of this information and the provenance report from that center, that most of the cases are majorly perhaps have less travel history now. And we're looking off these figures of confirmed cases, only 628. While in terms of contact tracing, we have about 8,000 from that number, and that's about 25% of the total. But what we've been told that we're witnessing is more community transmission, and it's about 73% essentially that are unknown. But let's take you to one particular state, and that is zeroing in on Edo State. We'll just see an update of that, just to quickly take a look at what we have in just a moment. Edo, here we go. So we're seeing Edo with the latest confirmed cases updated. It's in the southern part of Nigeria. It has tested over 9,000 COVID-19 samples. 24 hours ago, also it lost 2 persons, increasing the death toll to 62. It has, of course, a lot of people have recovered from that state as well. And it is the top 5 of the highest number of cases in the country. And the local government areas are also affected by that. We'll bring you a report shortly on why we're seeing a lot of cases. But from the government standpoint, the governor, sometime at the end of June, said that the state's cases were expected to peak based on models according to the state's epidemiologist. But so far, 2 weeks after, we do not know if this is the period. They've been recording cases on a daily basis. Also, before that time, the government said that, warned about those who chose to self-isolate rather than submit to government facilities, and said that they would be, their names would be published. But then let's bring you indeed what has changed, and that is coming from Edo. Our correspondent, Obaze Osaze, brings us this update.
Life, as it were, is almost back to normal in Benin City, the Edo State capital, as people are carrying on as though the COVID-19 pandemic is not an issue for concern anymore. Guidelines stipulated for curtailing the spread of the coronavirus are being violated, especially wearing of face masks and social distancing. Amidst the fears of escalation of community transmission, what plans has the state government to ensure better compliance of the people?
We have intensified risk communication. We have continued to sensitize the public, make them understand the reason why it's important to keep to the regulations of NCDC for managing the spread of this disease. Wash your hands frequently, wear a face mask when you're in public places and crowded places, and so on and so forth.
However, the government believes Edo State has not done badly in terms of management of the crisis.
We have a very functional isolation center. In Stella Obasanjo Hospital. We also have in University of Benin Teaching Hospital and in Ira Specialist Teaching Hospital. In Edo State today, I think we have capacity for more than 500 patients at a time, who come down with COVID, and we have not yet exceeded bed capacity at any point in time.
We're at the Stella Obasanjo Hospital right here in Benin City. As you can see behind me, that's the isolation center here. However, this is a restricted area. In Benin City, Osazo Obaze Channels Television News.
Well, staying in the South, Governor Ifeanyi Okowa of Delta State, who recently recovered from COVID-19, and other members of his family made his first public appearance recounting his experience. The governor at a family Thanksgiving at the government house reiterated that COVID-19 is real, admonishing those who think that his family was given money to declare that they tested positive. Dr. Okowa stressed that the best way to avoid the devastating disease was for everyone to accept its reality and abide with the prescribed protocols, which he says would be enforced in the state.
Thank God that my daughter went for that test, because we did not even think that the symptoms of severe was going to be COVID. And we decided after she tested that all of us should test. We're having minor things here and there. And you will not believe it, that it attacked the 3 generations in the house, because we're all living in the same place. Myself, my wife, our children, and our grandchildren, except 2, the youngest of them. Of course, our goods. A very terrible thing. But thank God for everything.
Now, over in Kano State, efforts are on to reduce the number of infections, with recent data suggesting a spike in number of cases in some local government areas. Now, this next report, Tarani was highlighted as one of the 18 local government areas affected.
Tarani has been identified as one of the local government areas in Kano State where the guidelines for the prevention of COVID-19 are not observed. The cited markets and motor parks give credence to this. The level of compliance to prescribed protective measures is low. Many are not wearing face masks, one of the basic preventive items easily affordable. Majority of the residents here have personal reservations about the use of protective kits. Others believe that the virus either does not exist or is not as grave as medical experts warn.
The idea of going to quarantine somebody here is very difficult because their way of life, way of business, they need to go out, they need to do this, and they have to shop from somewhere to bring to their daily home for feeding.
Understanding how the virus is transmitted can help communities curb its spread.
One thing that is very important is for people to take action as individuals. They should maintain the habits of regular hand washing with soap and water, use of hand sanitizers in the absence of water supply, and then to ensure social distancing.
More testing is required as experts give reasons for possible increase in cases in Tarauni local government area.
80% of the infections are mild, so the individuals do not even know that they have been infected.
In the absence of a vaccine, Increased awareness and compliance to the COVID-19 preventive measures are of top priority to ensure a decline.
Even if a vaccine is developed, in probably 2 years' time, that vaccine will lose its potency, and then a new one has to be reinvented.
The ease lockdown brought relief to most people. Having another lockdown can only be more worrisome. Residents of Taurani are directed to keep on with the washing and sanitizing of their hands and observing social distancing.
Dr. Abbas Shehu Bala, an epidemiologist and part of the NCDC Rapid Response Team that went to Kano earlier on. He joins us from our Abuja studios. I'd like to thank you for joining us on the program.
Good evening all, and thank you very much for having me here with you.
All right. Now, if you listen to the last report, a way of life, a way of business, it seems adapting to this new normal due to COVID-19 appears difficult and perhaps not just in Kano, in many places as well.
Yeah, as you mentioned, I think that's a problem across the country. And as I know, we have a lot to do with regards to risk communication because the belief and the natural health-seeking behavior, especially in Kano and in most part of the country, is quite poor. And with the COVID case in particular, lots of emphasis need to be placed. As I know, there is a study currently going on in Kano where they're trying to assess the conception of individuals with regards to the protective measures against COVID-19 amongst the populace in Kano, which I believe the results from these findings will help the IPC pillar in designing and improving on the communication materials which they will use in enlightening people, and probably the state might end up using it probably in situations where policies need to be reviewed with regards to this, because it's known the virus could be asymptomatic in most cases, amongst most people. So the major preventive measure is the personal protections that need to be enhanced. So it's really a problem. And I know that the IPC pillar in Kano has been working day in, day out with regards to this in collaboration with other partners. They've been airing jingles, they've been airing, spreading information across, reaching out to religious leaders, community leaders. But perhaps a lot needs to be done in light of that. And I believe in the coming days, and I hope in the coming days, we'll see changes towards that.
Perhaps to finally get your thoughts, and this is perhaps on areas of culture, tradition, and even religion. What do you think years of all of that plays in the efforts to curb the spread?
Yeah, so as I mentioned, mostly in the northern part of the country, you have poor perception, poor health-seeking behavior amongst the populace. And this is not commonly seen in COVID alone. When you look at all other diseases, you can see that the indices are not as impressive as they ought to be. And you can relate that to that perception and that behavior. And well, I wouldn't want to relate it more to religion, but rather it's basically an attitudinal thing, and probably culture might have some little role in it. That's why there is need for reorientation, and there is need to find out the specific reasons through research why these things are failing, why the people are not adhering, so that solutions towards that could be tailor-made and to suit the environment. I think that's what the team down there are trying to do.
All right, we appreciate, we would like to thank you. Thank you so much, Dr. Abbas Shehu Bala, an epidemiologist. Thank you for joining us on the program.
Thank you very much. Thank you.
In Africa, 10 countries account for 88%, that is 440,672 of all reported COVID-19 cases in the African region. South Africa accounts for more than half of the cases, while other countries on the list include Nigeria, Ghana, Algeria, Cameroon, Cote d'Ivoire, Kenya, Senegal, Ethiopia, and DRC. Currently, 33, that's 70% countries in the region are experiencing community transmission. 10 have clusters of cases and 4 have sporadic cases of COVID-19. The region has also observed increased incidences of importation of cases from affected countries within the region, largely fueled by long-distance truck drivers and illicit movement through porous borders. As of 14th July this year, cumulative total of COVID-19 cases in the African continent exceeded 600,000 cases, of course now at 625,300. This also includes about 503,000 from WHO African region and a total of 122,000 from the 7 African countries in the WHO's Eastern Mediterranean region. Now, some 2,065 health workers in Ghana tested positive to COVID-19. According to Ghana's Health Service Director General, 6 health workers who had been infected had died, but 1,870 others have recovered. The rest are receiving treatment at different isolation centers. The Greater Accra region, which includes the capital city, recorded the highest number of infections among health workers. Authorities say they are providing more protective gear to health facilities to reduce the infections. Now, a public health physician, Dr. Chidumga Ohazirike, joins us via Skype. We'd like to thank you for joining us on the program. And I'll begin by asking your take on the rise that we're seeing in confirmed cases across the African continent.
Good evening, Millicent, and thank you for having me. You would understand that the African continent is behind the world as per the rise in cases. In total, the African continent contributes a little over 5% of the global number of cases of COVID-19. And then South Africa is the leading country when you look at the number of cases, and it had the highest daily count in its cases on the 11th of July with a little over 12,000 cases. So what this shows us is that COVID-19 is gradually gaining momentum on the African continent.
So South Africa is recording the highest, like you mentioned, but it's also testing the highest, and its daily testing is, I think, number 4 behind Peru. Do you expect that when you compare that to Nigeria, and this is the biggest population in Africa, do you expect that when we intensify our testing, we will also see a surge in cases?
Yes, that is very correct, because WHO has a testing average of 2,159 per million of your population, and Nigeria is way below that testing average. Countries like Botswana, like South Africa, like Mauritius, and even Ghana and Senegal are way past the 2,000 testing average for Africa. So Nigeria has to do a lot of testing, and when you do more testing, definitely you would see more cases. Even for the targets that we've set for ourselves to achieve 2 million tests, we haven't done that. We've barely tested 1% of our population. And then it also shows that we haven't maximized the testing capacity that we have, despite the increase in the network of the laboratories that we have put into the laboratory network. Nigeria had a goal to increase its testing by this time to about 7,000 tests per day, and we haven't reached that target yet.
Are you worried by the airborne nature of the virus, and what else changes in terms of how we can protect ourselves from getting the virus with this new characteristics?
Okay, so what has happened is WHO issued a new guideline on COVID-19 transmission, the modes of transmission for COVID-19, and there is emerging evidence of airborne transmission in certain settings. So aside from healthcare settings where we have aerosolized generating procedures, you can also have some form of airborne transmission in indoor settings where physical distancing is not maintained and people are not wearing masks. And so what kind of indoor settings are these? This will include gyms or fitness centers, clubs, restaurants, or where you have mass gatherings indoors like churches or religious gatherings. So this is an emerging evidence, though we need more research in that area for us to really describe airborne transmission or state categorically that airborne transmission is a mode of transmission for COVID-19, but this is the emerging evidence. Okay, so for what we need to do, the preventive measures are still in place. What the new guidance is reiterating is the importance for us to stick to the preventive measures that have been stated: wearing masks, washing our hands, respiratory hygiene, maintaining physical distancing. But what has changed is also that people who are in the vulnerable population, people who are above 60 or 50 years for us in Nigeria, should use medical masks when they are going outside of their homes. And I think that is important. So for that category of people, they shouldn't just wear cloth masks, but they should use medical masks when outside of their homes.
All right, we appreciate your time. Thank you so much, Dr. Tim Dumgao Hazurike, public health physician. Thank you for your thoughts on this issue.
Thank you very much, Millicent.
British Prime Minister Boris Johnson says coronavirus restrictions will ease further in England on the plans for a significant return to normality by Christmas. Under the new guidelines, people may use public transport for journeys immediately, while advice for employers will change from August the 1st. He explains the companies will now have more discretion to bring staff back to workplaces if it is safe to do so.
Unveiling the next steps in the easing of England's COVID-19 restrictions, certain businesses, leisure settings, indoor performances and sports stadiums have been given the green light to start welcoming people back in the coming months. Announcing the plans, British Prime Minister Boris Johnson says his government is hoping for the best, but planning for the worst.
Throughout this period, we will look to allow more close contact between friends and family where we can. It is my strong and sincere hope that we will be able to review the outstanding restrictions and allow a more significant return to normality from November at the earliest, possibly in time for Christmas.
Thank you very much, Mr. Speaker. With permission, I'd like to make a statement.
Meanwhile, Health Secretary Matt Hancock has called for an urgent review into the compilation of the coronavirus deaths data in England. It comes after it was confirmed that the number of reported deaths included people who had tested positive months before they died.
For weddings and corporate events.
Away from the UK, Australia's New South Wales state has banned dancing, singing and mingling at large-scale gatherings as neighbouring Victoria reported a record daily increase in COVID-19 cases.
Hold on.
In other developments, researchers in the country have devised a test that can determine the coronavirus infection in about 20 minutes using blood samples. The test can determine if someone is currently infected and if they have been infected in the past.
So spread the word, not the virus. Our website, channelstv.com, has the latest update on the pandemic. All you need to do is log on, access news in health and several other stories as well, business, sports, Africa, and around the world, all at your fingertips. That's a COVID-19 update. Thank you for watching. I'm Millicent Nwaka. Stay healthy, stay safe.